and to weave it into the work that we do with respect to case investigation and contact tracing. So there's an awful lot that has been going on for a long time behind the scenes related to higher education, and I think our community is paying a lot of attention under the that we don't add to the number of cases. We think a lot of students are already here, already have been engaged in getting together, and so we continue to message, especially to that young population, please continue to heed the call to do better with respect to gatherings. And so hopefully as we move forward, we won't see a big downstream effect for the portion of our universities that may take place in an in-person environment. And with that, I will turn it over for any questions.
Going back to the CMC, do you know how that outbreak started? What was the contract tracing for how that began?
I don't very specifically. With the inmates having been of long duration in the facility, those who have been impacted, and with the plan that any new inmate gets quarantined in a different location within the facility, I've got to believe that some member or members of the staff who were infected, probably unknowingly, asymptomatically, may have been the leading edge of that outbreak. I don't, having said that, I also, at the same time, I ask of especially staff who are young and healthy and invincible that they do take all the precautions. I also don't want to put too much of the weight of transmission onto, necessarily hardworking staff who are showing up every day at the prison to do a really challenging job. And I can't say that it was necessarily someone that went to a bar or had a family gathering. So I just want to be clear about that.
When it comes to quarantining and isolation, what are the guidelines related to people who may be sick versus if you're a contract trace person who may be around somebody who tests positive?
Yeah, so it bears going through this again and again. I myself mess it up at times, the difference between isolation and quarantine. So isolation is for the person who has tested positive, whether or not they're sick. So this is a person who has known virus in their system and can transmit it to others. That person needs to be under an isolation order, and we do issue orders. And most, the vast majority of people comply with the fact that you have to remain in your home, not even going out to the store, so we provide some wraparound support for that, so that you will not transmit to others for a minimum of 10 days. For people with more severe disease, it can last as long as a 20-day period, that isolation. Most of those people will be in the hospital, and so it's not under our order. Quarantine is the term for people who have had a contact of a close nature, whereby they may well have been exposed to the virus and they may be incubating, they may be getting ready to become positive, but they are not yet actually sick with the disease or infected. And those individuals, we ask that they remain out of circulation for the full 14-day incubation period, because that is the time frame in which they are at risk of becoming infected, not knowing it, and transmitting to others.
If they get tested during those 14 days and it comes back negative,
they still have to be quarantined for 14 days.
Okay.
If they become positive during that period, they now become a case and they're subject to isolation.
Okay. How do you determine if someone is deemed recovered from COVID-19?
Yeah, so we're using CDC, Center for Disease Control's definition, which is a person who either is 10 days out from their symptom onset in most cases. Again, remember I said if you're severely ill, severely immune compromised, we may consider a 20-day period. For the vast majority, 10 days from symptom onset, as long as at that 10th day they are no longer symptomatic with fever or respiratory illness. So it has to be a minimum of 10 days, and within that, the last 24 hours, they have to have been symptom-free and fever-free. And I don't mean a lingering cough, but where respiratory symptoms have dramatically improved. For the because many people are asymptomatic, have no symptoms, and they test positive, those individuals, we consider them recovered when they are 10 days out from their positive test.
Okay, thank you.
Dr. Borenstein, just to clarify, the fine-tuning of the cause of death, how closely does that align with what's happening at the state and the national level?
Yeah, so different states and nationally, it has not been absolutely clear. We know other counties in the state of California are also counting cases where COVID has been a contributory factor, but not an underlying cause of disease. But in looking at it and what I have read and seen even at a national level, there may be a small variation in what the total count is. If you count some of those additional deaths where it was contributory but not the defining cause of death, but that is still a relatively small proportion.
And one more question for me regarding education and those waivers that you've talked about the last couple of weeks. I think yesterday at the supervisors meeting you mentioned, I think there were 11 schools now in the county, all of them private, small. What kind of an update can you provide on where those stand?
So between yesterday and today, we have not moved any of them into the approved column. There are 11 private schools that have applied for a waiver, and we have not received any at this time from any of the public school districts.
Those are going through state approval?
The ones that have applied?
Yes. It goes through you, and then
no, they're going through our local process. Once we complete the review, we have told our school districts and our schools that we would try to turn that around in a week's time if we could. We are keeping to that schedule, but with some of these we've had to submit back to them for some additional information. We're trying to meet their opening deadlines. So none have actually gotten through the final hurdle of approval. At that point, at the approval point, is a notification to the state rather than a state approval.
Are you making those public, or will you make those public?
We will identify which schools have been granted approval for an elementary school in-person attendance waiver.
If they do get approved?
Yes.
Okay.
Mm-hmm.
Dr. Bronstein, is there any update on the ethnic breakdown of cases in the county? I know it's been an ongoing question.
Yes, thank you. That was a good planted question. That is exactly one of the items that we plan in the coming days to make available on our updated website.
And has it taken more, review of how it's being reported? Like, how are you able to gather that information at this point?
A lot of the issue in our why we've held back a bit is we just weren't getting that information for a substantial portion of the cases, and we wanted to really push forward on making sure that our information was solid. We really have been emphasizing that with our team now to try to get that information if at all possible. It was not coming through on a lot of the laboratories, so we're now getting it through contact tracing, and we feel like the data is more reliable.
And last question for me, in regards to the jail systems, CMC and HASH, are there visitors allowed into those systems, and are there preventative measures for other facilities?
So each facility has their own visitation plan and allowance and safety measures with visitors, and I actually can't speak in any detailed way to that.
Other questions?
Thank you.
Thank you again for coming today and tuning in online and on TV. Just a few closing comments for today. You can still get all our COVID-19 information on our county's website, readyslo.org, or by calling the Phone Assistance Center or the recorded public health information line. We continue to offer free COVID-19 testing by appointment at San Luis Obispo Veterans Hall and Grover Beach's Ramona Garden Park Center. Additionally, through August 20th, we will be testing at the Pavilion on the Lake in Atascadero. You can make an appointment for any of these testing sites at readyslo.org. And if you have limited or no access to the internet and need to make a testing appointment, you can also call 888-634-1123. Thank you again for tuning in today. You can find these briefings live on San Luis Obispo County's Facebook page, as well as on our county's homepage. They are also live streamed on KCOY and KSBY, and additionally available live on cable channel 13 and rebroadcast on public access channel 21 at midnight, 8 a.m. and 5 p.m. until the next briefing occurs. Thank you again for staying informed. Be well, and we'll see you all next Wednesday.
Stay with your news channel for breaking news updates on air and on all your devices.